It is time that we make change in our healthcare system. Our government is putting their money in the wrong places, and I'm here today to show you that we and the government and insurers should be putting their money toward investing in preventative care. So, I'm going to be comparing reactive and proactive care and the cost of each and what needs to happen in order to make prevention pay. So what is reactive medicine? It's just like it sounds. It's when it is medicine that happens after somebody's already diagnosed with something. So once you're diagnosed with a chronic disease or something else, then they treat you. Or once you have an injury even, then they treat you. It's reactive medicine. So it happens after the fact of you getting a disease. And a lot of diagnoses happen years after you actually have the condition and you just didn't know. And so it can be even a delayed reaction and cause a lot of detriment to our health as people. And so that's reactive medicine. Proactive medicine is acting before you get sick. So things like regular doctor visits, screenings, colonoscopies, vaccines are considered preventative medicine. Stuff like that is considered to stop disease before it happens. Even programs of educating on lifestyle, educating on safer ways to go to school or how to stay safe in certain situations are also preventative care. Things that prevent illness or injury. So that sounds better to me. I'd rather not be sick than sick, right? So why is all the money going toward us being sick instead of us being healthy? Let's look at the cost. So I knew that reactive medicine was expensive, but boy, howdy, I did not know how much. Okay, I'm gonna read you some statistics that I found. So from the CDC and prevention, CDCP, we have heart disease and stroke, which costs $233.3 billion annually to the healthcare system. It's $184.6 billion in businesses and the economy due to people being taken out of work. And it causes 843,000 deaths annually. Heart disease and stroke alone. Cancer costs $183 billion annually to the healthcare system. By 2030, those costs are projected to be $240 billion a year. 1.8 million new diagnoses are made each year in the US alone. And in the US, 600,000 deaths occur each year. Wild. Okay, that's just cancer. Diabetes and diabetes-related complications costs $413 billion annually. 38 million Americans have diabetes, just the adults. 98 million American adults have pre-diabetes. Obesity costs $173 billion annually to the healthcare system. 21% of children have it, and 40% of adults have obesity. Crazy. Alzheimer's disease and other dementias cost $360 billion a year, and that is projected to be $1 trillion by 2050. This disease affects 11% of adults older than 65 years old. That might not sound like a lot, but it is. That's a lot for a very detrimental disease. Arthritis is $300 billion in medical and lost earning costs. So medical and economy loss. 20% of adults are affected by arthritis. Chronic kidney disease costs Medicare $95.7 billion a year. And then tooth decay, of all things, costs $46 billion just in earning costs due to lower work performance. And 34 million hours of schooling was missed by children having emergency dental care in 1 year. So that's the cost of reactive care. Somebody's making money. And it's not the people. And it's I don't know how insurers are making money. Some say there might be some corruption. Anyway, moving on to the cost of proactive medicine. Oh wait, it saves money? Interesting. How's that? How does it save money? For those who have chronic diseases, regular visits to a primary care actually adhere to peak savings with their insurance. Interesting. So proactive care costs money up front, but over time saves a drastic amount of money. And so you still save money in the long run. I think long run is what we should be looking at, but that's not what's happening. So why should we care? Why should we care? Because you would think the majority of people would want health. Maybe they don't know that. So yeah, we should care for our health. We want to have long, happy lives and be able to have high quality lives at that. Just by eating habits alone, Dr. David Katz found that 80% of people, or there was an 80% reduction in disease just through eating habits alone. Amazing. Like, that's a simple fix. So a lot of disease is preventable, and we should be thankful for that. Be thankful that we can reduce the risk of cancer and diabetes and heart disease and stroke and tooth decay. Because I don't know about you, but I hate being sick. I hate having a sore tooth. I hate feeling not great. I don't know who does. Along with health, longevity is another reason of needing to care about this proactive versus reactive debate. And without having preventative care, we're going to have shorter lives, and the lives we live are going to be low quality. So we don't want that. By having less disease through prevention, we would be able to have less medications, less doctor visits, and not have a need for long-term care. That sounds like a good deal to me. Lastly, if you don't care about health or longevity, the third reason we the people should care about preventative medicine is the savings. We too would save money. It does cost more upfront, and it's scary to be able to pay more or have to pay more upfront. But over time, over the years, you will save more money than you would have if you didn't prevent disease. So, health, longevity, and savings is why we should care. Why should the government care? Well, I'm sure their first reason would be money. So that is why I think they should care, is because, again, in the long term, the government would save money if they invested in people's health, they would end up having more savings. The Trust for Americans' Health found that having the government invest in prevention programs with $10 per person each year could save $16 billion annually, resulting in a 560% return on investment. Government, hello, you can make so much money. Are you kidding me? Or save so much money. Okay, next, the Trust for America's Health showed that school systems investing in increased physical activity resulted in 3,300% return on investment. Okay, that's pretty good. I'm sold. Government, you should be sold too. That's a lot of money to be saving. That's a lot. That's a big percent. That's a big percent ROI. But not only will the government save money, they would have stronger, healthier people that would outperform other countries and be able to have a stronger economy, a stronger workforce, a stronger military, and we would be able to be more self-sufficient as a country and just a happy, healthier nation and be more satisfied. And the government would probably get away with more because the people would be satisfied because they're taken care of. And so even if the government still wants to be sneaky sneaks, at least satisfy your people. So the government should care because it would save them money and give them a better economy and stronger, happier, healthier people. So would insurance save money? Should they care? Are we working against insurance? Right now, insurance has to lobby money in order to earn. Seemingly, I think that's how they allegedly. This was a hard deep dive. This could be a whole series of hour-long videos describing how insurance works and how the government works and how they make money off of sickness. Whew. But I'm just trying to tell insurers today and the government today and we the people that prevention does save money. And so, yes, the insurers would save money because they would have less claims on insurance, less people having to have long hospital stays, less people having disease and injuries in general. The Trust for America's Health found that through diabetic prevention programs, there was a decreased reduction in 58% of participants. So this saved insurers $2,650 per person in that study, and that's just diabetes alone. So I don't know, that makes sense to me. They save money. Hello, let's prevent disease instead of react. But if that wasn't enough, the Trust for America's Health found that having a Safe Routes to School program performed by New York City saved insurers approximately $230 million in reduced injury claims. So just one little simple program of, hey kids, let's take this route to school. And boom, they saved $230 million. That seems like an easy solution to save money. And the insurers, I think money's all they care about, so I only put 1 point for them. Hopefully they care about people's health, but unfortunately, that's not the world that we live in. So, alrighty. What needs to happen? What needs to happen? Ultimately, we need prevention to pay. We need people to pay for prevention instead of focusing so hard on, I'll just wait till I get sick. No. We, the people, must start caring about our health now. Once the people show value in health and that is a main concern that we have, then the government would be forced to care because people affect policies and policies affect politics. So if we really truly show the work and care and involve ourselves in advocacy programs and call our legislators, we can make a difference. And we also need to start paying for our health now. Start buying better groceries. Start just going outside. A lot of preventative care is free. And so invest in yourself, invest the time in yourself to heal before you get sick. Next, what needs to happen? The government needs to invest. I'm sick and tired of the government just being okay with having sick people. They need to invest in the people because we care, and they should care because it would boost the economy. Again, in the long run, not immediately, but they would have a huge profit. Next, what needs to happen is insurers need to care. They would make money. I feel like that is enough to help them to care, but it seems like there's corruption and they make money off sick people. And so that's alleged, of course, but there is a huge profit to be made by insurers if they quit the corruption and start investing in healthy people. Lastly, our employer needs to invest. If our employers invest in healthy employees, then they will have less call-offs, less absences, less paid premiums. They would be able to have a just healthier work environment and higher performance. So that was my breakdown and just scratching the surface on reactive versus proactive medicine, what it is, what the costs are, and what needs to happen. I am hoping that down the line, we will be able to change the government and help work toward a healthier country and be the leader of all the other countries in health and wellness and high performance, because we care, the government cares, and insurance care. That's a beautiful picture. I hope that happens sometime in my lifetime and definitely in the next generation. There are a lot more statistics and barriers and things that need to happen, but this is an introduction to why we need to make prevention care. If you have any tips on how we can make prevention pay, leave a comment down below. If you have any questions, also leave a comment down below. So let's find a way to make prevention pay. Thank you for watching. Bye-bye.